Hi, I am Dr. Ramakrishna Chowdhary, consultant and head Department of Neurosurgery at Arete Hospitals, Gachibowli, Hyderabad. Today we are talking about facial pain. So usually patients do visit a dentist saying that they have a tooth pain or a pain on one side of the face. So apart from the toothache or the reasons for the pain on face because of tooth per se, there is something called as trigeminal neuralgia. So where the patients have typical shock-like pain in one side of the face or part of the face which lasts for few seconds and against a remission reduction followed by again recurrence of pain due to multiple triggering factors. So triggering factors could be like if they are exposed to a blow of air from the fan, or if they start having some cold food or cold juices, or they wash their face with a splash of water. These are triggering factors for the trigeminal neuralgia. So what is trigeminal neuralgia? It's nothing but a lancinating severe pain in one side of the face which lasts for few seconds followed by remission and aggravated by the triggering factors which I already told you. So what is the cause for this kind of facial pain? So usually because of the face, or the one side of face is supplied by something called as fifth nerve, that's a trigeminal nerve, which relays the sensation from the face to the brainstem. So where the nerve goes and relays in the brainstem, you have something normal blood vessel there. Whenever this blood vessel attaches to the nerve or gets closer to the nerve, this generates an electric impulse which appears to us as a pain. So apart from this cause, there are some other causes like a tumor or a demyelination, that is the weakening of the layer over the nerve, can also be the reason for the trigeminal neuralgia. When the patient comes with this kind of symptoms, we get something called MRI of brain to look for any blood vessel loop which is touching the nerve there. If at all this vessel loop is there, then it's suggestive of a trigeminal neuralgia because of the vascular loop. So coming to the management, depending upon severity of pain, the primary management would be with a medical line of management where we give 2 to 3 drugs to reduce the pain. If patient is symptomatically better and is relieved of that one, then we ask the patient to continue the medications. If the patient doesn't want to go ahead with the medications, or if symptoms are not related to the medications, then the other modalities of treatment are available. Like one is the surgical part, that is a microvascular decompression, where we separate the nerve from the blood vessel, put a graft there, and we relieve the pressure onto the nerve. This is surgical part. We do a surgery from behind the ears, make a small hole in the bone, go in, decompress the nerve and the blood vessel, and the patient gets complete relief of pain. Surgery is around 98-99% successful if done properly. The other modalities of management are radiofrequency ablation, where we ablate the nerve with a radiofrequency probe going through the cheek. The other modality is the radiation. We give a SRS or stereotactic radiosurgery to the involved part, there is a nerve there. But of all these modalities, surgical part is the best one because it gives relief around 98% and without recurrence is quite uncommon. The patients who are suffering from trigeminal neuralgia need not worry. There is always a multiple models of management as there, and surgery is minimal invasive and the results are extremely good. Thank you.